attendance, we have Dr. Elizabeth Goldberg, who is here to answer any questions that you all may have. Dr. Goldberg is also a representative of the Providence School Committee, so we're very happy to have her here. And lastly, we have Kechara Bradford. Kechara Bradford is our Deputy Superintendent for Academics, so she is here. We wave Kechara. She's here to answer any academic questions that may come up. So with that said, we will get started. Jonathan, if you don't mind, we'll have you present the norms, and then we'll have the superintendent say his welcome.
Okay, so I'm just going to start screen sharing right now. Give me 1 second. So good afternoon, everyone. Thank you for joining us tonight for this town hall. I just wanted to go over some of the norms for tonight's meeting. So the presentation is going to be in webinar format. So what that means is basically you're going to be able to see the panelists, not necessarily each other, but we do encourage that you use the icon at the bottom of the screen to ask any questions. Throughout the meeting, we will be answering questions as well as trying to save some time at the end to answer some live. So the icon is at the bottom. Again, it's Q&A. You just submit your question there. Let me just move to the next slide if I can. Is everybody able to see the screen?
Yes.
Okay.
Yes, thank you, Jonathan.
Yep. So I'm not sure why it's not letting me go to the next slide. It's everybody's pictures here, but basically we're going to be recording this session, like Nick said, with the opportunity for families to submit their questions. Whatever is not being answered tonight, we're going to try to get back to either in the session tomorrow or at a later time. We will compile all the questions together and get back to the families and post those questions as well. So we just look forward to having this discussion about the start of the school year. Everybody's excited to have the kids back in school, and we just want to discuss what our plans are for this evening. So thank you again for joining us.
Thank you for that, Jonathan. As Jonathan mentioned, this is a webinar format, so any questions that you have, please put in the question and answer section of the webinar. Natalie, Zach Scott, our Assistant Superintendent of Operations, is trying to log on. If you could let him into the space as well, that's a bonus for us. Thank you, Zach, for joining us this evening. Superintendent, I will turn it over to you for your welcome.
All right. First of all, I would like to say how excited I am. Can't wait, inspired for the beginning of the school year. Knowing that this is a brand new year, it's a lot of experience for many of us. And I know that my parents have a lot of questions on the safety and wellness of our students and making sure that we are doing everything with our power, make sure that all schools are a safe place for the students to be. I know the presentation will speak to you about all the safety issues that we have put in place, but I'm so excited that I have the opportunity to speak with my parents and asking all my students to in-person learning, which we know that in-person learning is the best thing for our students. So I just want to say thank you. Thank you for the kind words. Thank you for the believing in the work that we're doing as we move forward. But just make sure that any questions that you have, the people on this Zoom are more than happy to answer any questions that the parents have. Once again, thank you to everyone, and we're going to start a fantastic year. So I just can't wait. I'm so excited. Thank you all.
Thank you, Superintendent Montañez. Much appreciated. All right, Barbara, we will head right into the presentation. Again, we're joined by Zach Scott. Zach, welcome to tonight's town hall. Let me share the screen here and then we can get started. All right, Barbara, the floor is yours.
Okay. Good evening. My name is Barbara Rios, and I'm happy to be here this evening to share with you the Providence School Department's plans to keep your child safe as they enter the 2021-2022 school year. So it's so important that we provide our students with a safe, stimulating, and supportive in-person schooling 5 days each week. The DOH Department of Health data states that only 5.4% of positive cases among Rhode Island's pre-K through 12 students and staff were due to documented school-based only exposures. Most exposures were from outside of the school environment. The school buildings, and I believe there was a question in the Q&A. The first question was about ventilation, particularly at PCTA. All of the school buildings have HEPA filters in their classrooms for ventilation. They also ask that as often as possible, the children are allowed to go outside for lunches, and recess because it's less likely to spread in an outdoor environment. They're going to have personal protective equipment, which you've heard on the news is PPE equipment, and that is used by the nurses in the building and the childcare workers who will be screening the children, and they'll be staying in an isolation room if they have COVID type symptoms. They also will be doing cleaning and disinfecting if there is a probable or positive case on top of normal everyday cleaning. Students will be wearing masks. If a child cannot wear a mask for a medical reason, then we ask that they provide a doctor's note. And there is spacing and grouping between pods in different groups, depending on if they're in elementary, middle, or high school. We'll also have COVID screening, which will be an antigen test, which is Binax testing, which is a rapid test, or we also will have training this week for PCR testing, which will be done in the school. And the PCR is the test that takes typically 48 hours to return to get the results. And we also are having, and we just scheduled them, as a matter of fact, yesterday, the clinics to provide those 16 and older vaccination clinics in certain high schools. Quarantine is for students and staff that have been exposed to a positive who have not had a vaccine or who have had virus within the COVID virus within the last 90 days. So if they fit that category, if they were exposed to a positive, they do not need to quarantine. So quarantine is only for an exposure. Isolation is when a student or a staff, tests positive, then they will be isolated for 10 days. And then food and transportation. So in some schools, the children will be going to the cafeteria, and some schools they'll be eating in the classroom. It's different in different schools and at different levels. And transportation, if it's a bus, then we ask that the bus drivers provide a seating chart and have family members sit together so that if we do have to do contact tracing, we're able to do that to the best of our ability. Next slide. Classroom has air purifiers with filters that meet or exceed CDC recommendations. And those are the HEPA filters. There's a picture of one on the left here. It's an air purifier. And those are in all of the classrooms. So the school buildings with air conditioning will be increasing the outside air intake, and classrooms without air conditioning may use window fans in addition to air purifiers to increase the air flow in the classroom. Personal protective equipment. We have a lot of PPE equipment. We have masks, hand sanitizers. I know parents are very concerned of the desks going to be cleaned. Yes, we have disposable adult masks, student masks, face shields. So if your child forgets his mask, comes to school, we can provide him with a mask, him or her with a mask. We also have face shields. Some of the children may want to wear a face shield, or parents may want them to have a face shield on top of a mask. Or if they are a child with some disabilities, they can wear a face shield if they're unable to keep the mask on them. We have hand sanitizer, disinfectant spray, antibacterial hand wipes, alcohol wipes, different types. We have tons of dial soap, gowns, which will be used by the staff who are working with somebody who is potentially positive or is positive for COVID, gloves, and thermometers. So a level 2 cleaning is done if there is a probable case of COVID. So for instance, if there was one child in the classroom who had COVID-like symptoms, then he would be sent to the nurse for an evaluation. And if we feel that he or she positive for COVID, then we would inform the custodian, and they would do a level 2 cleaning. And that is it's a classroom cleaning, but it also includes high touch surfaces. A level 3 cleaning is a deep cleaning. And that's when they go in. If a child has tested positive for COVID, then we would have the students go to a different classroom so that we can do a deep cleaning of that room and all the surfaces within that classroom. And the daily cleaning is a level 1 cleaning, which is they clean all the high touch surfaces and objects. Our custodians are really good. They take this seriously. Anytime I've ever asked them to clean, they do a really good job, and the nurses always follow up with that. School buildings, so masks. All school-based staff members, students, and visitors will be required to wear a mask indoors. Mask use is required outdoors if that activity involves sustained close contact between individuals not in the same stable group. So the teachers will try to keep them in their stable group when they're, getting out their energy during recess. But if the kids are combining and the pods are mixing, well, then we would want them to wear masks if that was happening. Mask wearing exceptions will be made for children under age 2 in some rare individual circumstances, which we talked about. Spacing and grouping. In the elementary schools, we'll have stable groups. They keep the same students in the classroom together throughout the day. Middle and high school, the physical distance isn't as required because we are encouraging full vaccination, but will still be encouraged and practiced whenever possible to keep them distanced. In non-stable groups where students are not eligible for vaccines, because in middle school we do have some older and some younger students, at least 3 feet of distance is recommended as much as possible. So we ask that you monitor yourself and your children daily for symptoms of infectious disease. So if you're feeling sick, if the child is sick, we ask that they stay home. If they have COVID symptoms, then we ask they stay home. Call your doctor, your healthcare provider, and get a COVID test. If you feel fine, but you are unvaccinated and someone in your home has COVID type symptoms, then we do ask for you to stay home until you have a negative COVID test. So the symptoms of COVID are cold and allergy type symptoms, which can make it a little tricky. So cough, shortness of breath, problem breathing, of course, that's much more serious, chills, muscle pain, loss of taste, smell, sore throat. But we also see things such as fever and a runny nose, diarrhea, particularly in the little ones, and they can feel nauseous or vomit, headache, poor appetite, and they feel tired. Next, please. School-based testing. So this is voluntary. So we do have COVID testing in the schools. It will be done weekly for students and staff. School nurses can conduct asymptomatic and symptomatic testing when needed. So if the permission forms are signed by the parent, then the school nurse can check the student to do asymptomatic testing. So that would be when students don't have any symptoms, but we're just monitoring, say a couple in maybe another classroom have tested positive. We might want to do a little more testing to make sure it doesn't spread. And symptomatic testing is if they have one symptom, they will be required to test. And that would be all of those symptoms that we just talked about. But again, we do need parent permission in order to do that. Our goal is to have 100% of the student and staff participation. Family consent is needed for minors. In spring 2021, over 14,000 COVID-19 tests in schools yielded less than 50 positive cases. So it was that's quite remarkable, those numbers. The schools did much better than what we heard about in the news. Testing can uncover cases in those without symptoms. Spread was not high in a controlled school environment. So the masks, the spacing, the HEPA filters really works. And we saw low participation rates for the COVID testing, but we would love to be able to improve that this year. So there are 2-shot Pfizer vaccine, which is available for ages 12 and up. We are collaborating with the Rhode Island Department of Health, and we're sponsoring vaccine clinics at our school sites. They are scheduled for the high school, and that schedule will be posted shortly. So this is for quarantine. So all close contacts who are not vaccinated must quarantine for at least 7 full days, independent if they have symptoms or not. So what this means is if a child or a staff is exposed to a positive case and they are not vaccinated or did not have COVID within the last 90 days, and they are within, the student is within 3 feet of the positive person in the classroom, then they will be asked, sent home, and will have to quarantine per DOH guidelines, Department of Health guidelines. So on day 5 or later, they should be tested to see if they're positive. And if it's negative, they can return to school on day 8. But we do ask that they continue to monitor for symptoms. So after day 8, up until day 14, there is a chance that they could become positive, but it is very low. Most people test positive from exposure within the first 5 days. Close contacts may return to school on day 8 with a negative PCR test. But they can continue to monitor symptoms they must continue to monitor up until day 14. And if symptoms appear, then they have to go back to quarantining. Isolation. So isolation is the word we use for when someone tests positive. So they don't quarantine, they're actually isolating. So if they test positive, so say on the 10th that a child tests positive, then that is considered day 0. And we would start the 10 days from when symptoms first started or from the date of the positive test. If there are no symptoms, then we would start the day of the positive test. And the day of the test is day 0 or when the symptoms started. And then we would count 10 days from then. And that's how we determine the isolation period. So if someone tests positive for COVID, they do need to isolate for 10 days and can return to school when they do not have a fever for 24 hours without the use of fever reducing medications such as aspirin, Tylenol, or Advil. And there is an improvement in symptoms. The smell and taste, unfortunately, that can last for months before it returns for some people, but they can still return to school at that point. So food, we've been getting questions about that. That's great that we have this here. So in elementary, hot lunches will be served in the cafeteria or the classroom. They will be in stable groups. The students will have consistent assigned seating where possible. The students will be spaced at least 2 to 3 feet apart with 6 feet between tables as much as possible. We really want to keep the pods together. And non-stable groups are groups where they mix. Students should have consistent assigned seating. Students will be spaced 3 feet apart as much as possible. Middle and high school, the hot lunches are in the cafeteria. Transportation. So there are no capacity restrictions for school transportation. So last year during COVID, the bus numbers were reduced, but now there is no limit or restriction for how many can be on the bus. So the bus is considered a stable group. The bus staff will continue to create as much distance as possible between the children. Riders will wear masks at all times, and we ask that the household members sit together. And the first student will provide enhanced cleaning for buses between bus runs. Next, please. So stay connected. These are all the ways that you can stay connected as a parent. We have the Skyward Parent Portal. We have Kinvo, where you will receive text messages. We have Parent Link. ProvidenceSchools.org is the website. Back2School.org, that's where we can get a lot of the COVID information. FACE, Parent University, Back to School Nights, Parent Teacher Conferences, and of course, we love the volunteering. So I see there are 24 questions, 25. So let me see if we can go through this. Why, with Rhode Island being a high transmission rate now and Delta running rapidly, why isn't there a distance learning option for my child when the professional doctors have said another more deadly variant is imminent?
Barbara, I'd be happy to take this question.
That would be great.
I wanted to introduce myself. I'm an emergency physician. I care for children and adults here in Rhode Island. I also have a Master of Epidemiology from Brown University, and I have 2 children in the public school. So really happy to be here tonight. And I share a lot of the concerns that I'm seeing posted. And I personally, together with Zach and the Department of Health, have been involved in creating this these COVID guidelines. And there's many reasons why I feel this school year is different than past school years. And I wanted to just sort of summarize what we've learned over the past 18 months that we've had COVID, because I'm hearing a lot of concerns about Delta, which are legitimate. So we've learned that a multi-layer approach is very important. So we're seeing a lot of outbreaks, especially with the Delta variant in the southern states. There are a lot of differences between what we're doing in Rhode Island and many other school systems, and that is this multi-layered approach. So according to the American Academy of Pediatrics, both staff and students, regardless of vaccination status, should start the school year off with universal masking. So anyone that's 2 years and above will be masking this year, as we mentioned. That's one strategy to help with this airborne virus, because we know that COVID is transmitted through small droplets and through airborne transmission. So even if you're asymptomatic and you're talking, you can transmit it. If you're coughing, you can transmit it. Another really important strategy that we're privileged to have here in Rhode Island is weekly testing. So we presented some data on how low our pickup rate of the virus has been with our weekly testing previously. Delta variant is more infectious. And so I hear the concerns that there could be more spread, but compared to last year, we're doing weekly testing. Last year we did every other week. It's very important that you as a parent opt into this testing, because the more asymptomatic testing we can do of children, the more we can take people and move them into isolation if they are positive and they're not exhibiting symptoms. Some of the other strategies that we have is we've hired additional staff from Aramark to do cleaning. And we have multiple different approaches to how we do cleaning. But as soon as we find out that a kid has COVID or is exhibiting symptoms of COVID, we move the classroom, when we move the children and the staff to a different classroom, and we do deep cleaning. And that includes making sure that there is good ventilation of that classroom, because like I said, we know COVID is airborne. So that's why we have these air purifiers in the rooms with HEPA filters, which are the highest filtration devices that are available on the market. The other thing teachers can do to improve ventilation is open windows and doors, which we're also encouraging. I also want to speak briefly about Rhode Island, the pediatric hospitalization rate. So I have received permission from Lifespan, which is the only pediatric hospital in the state that hospitalizes kids, to share data. And I will tell you that our hospitalization rate for kids has been extremely low, even this summer with Delta transmission. So we've seen between 0 and a few cases of pediatric hospitalizations throughout the summer, despite Delta. So yes, we are a high transmission state. We are seeing high rates of COVID cases throughout Rhode Island. We are seeing kids infected. About 20% of the cases that we're seeing now are in kids, and that's largely because they are not eligible to be vaccinated if they're under 12 years old at this point in time. But that hasn't translated to high hospitalization rates in Rhode Island. And we believe that is because Rhode Island as a whole is a high vaccination rate. And so on the topic of vaccination, we are promoting vaccination in children 12 and above. The American Academy of Pediatrics recommends vaccination as a safe and effective strategy to prevent COVID. And we also recommend vaccination among our parents and families, because if you're a child that's at home with unvaccinated parents, you're more likely to get the disease and also pass the disease on to the school community. And so there have been vaccination clinics offered by PPSD over the summer, and we'll continue to do that this fall as well. So I hope that answers some of the questions.
Thank you, Dr. Goldberg. I have another question here. I'll read it out. Last year, I signed the permission form for asymptomatic testing, but I don't think my kid ever got tested. What is the process? Do students have to leave class to get tested?
Oh, I could answer that question. So typically the nurses do it in either the nurse's office or when they enter the school and go into the either the auditorium or an open room that's available. And parents are notified if they're tested positive. So it is possible that your child was tested but did not test positive. If you would like to know the dates when your child is tested each time, please contact the school nurse and he or she will make sure that you're informed each time.
All right, thank you, Barbara. Another question here. Let's see, hospitalization rates are low because schools haven't started yet, so that's more of a comment. Here's another, I respectfully disagree. I think it's all political, using, let's see, my child, forcing them to go to school while a more deadly variant is to come. So I guess this parent is just asking about more details around what we're doing in terms of offering safe schools. And I think we've covered some of that here in this presentation. There is also a question about distant learning and why that is not an option so far this year.
So we have an option for if somebody else would like to answer, certainly.
Sure, I can jump in. Just last year, looking at our student population and our data, our goal has been to return to full in-person instruction as much as possible. Of course, with keeping safety first is our #1 priority. So we look forward to embracing and welcoming our students back. We've heard that many of them missed school and being in person and face-to-face. We know that teaching literacy, you need to see and hear and be connected. And so as much as possible, we want to think about our students' academic, their social, emotional learning needs, their overall wellness. And we do think that returning in person to school is the best, safest place for all of our students. So we are looking forward to 100% returning to learning. I know last year, I think we were very successful with a safe opening for our students and just following all of our safety precautions, and also knowing that our teachers miss their students, our principals miss you all, we miss that community where we can really wrap our arms around our students and really accelerate learning is our goal for the upcoming school year.
Thank you, Chara. Next question, what is going to happen during the winter when they cannot open the windows? And I suspect this has to do with the ventilation in the classroom.
Yeah, and I'm happy to jump in here. So our classrooms, and we had this last year when we could not open windows, had air purifiers to provide that ventilation. So all of our classrooms, both at schools with air conditioning and without, will have air purifiers in the room. Those classrooms will also have additional precautions in terms of window fans for schools with that don't have air conditioning. And for those schools with air conditioning, they will not only be bringing in additional outside air, but also with a window open can increase ventilation. So those air purifiers meet or exceed the requirement for ventilation and filtration provided for by the CDC. And those open windows or fans and open doors provide additional airs beyond what the air purifiers provide.
Zach, can I also add that those window fans are exhaust, so it's not blowing air into the room, but also sucking the air out of the room.
All right, thank you, Superintendent. Next question, when students are home in isolation or in quarantine, how will the kids have access to learning? Will paper-based work be sent home, or will they work remotely and access Google Classroom?
Yes, so last year, parents, you should be very familiar with Google Classroom. This year, all of our teachers are setting up their Google Classroom accounts and getting everything prepared and ready. So teachers will be able to upload assignments, lesson, instructional resources, so that if there is a situation where a student needs to be quarantined, they'll be able to log into their Google Classroom and view their assignments and lessons from their teachers.
Sorry, Nick, we couldn't hear you.
Yep. Why aren't vaccines mandated for teachers and staff? Sorry.
I can start. So one important piece of data, and while we don't have this for Providence specifically, we do know that statewide, 89 and probably at this point 90% of school-based staff members have been, have been vaccinated. So while it is not 100%, it is close statewide. And while we don't have those Providence numbers, I would suspect they're fairly close. Obviously, as we learn more about the impacts of vaccines, I mean, we are considering what potential requirements might be for vaccines for staff members. I think we're in a fortunate spot as a state compared to other places where a large number of adults are vaccinated. But that is something that's under consideration for potentially requiring that at a future date.
Thank you. Next question, do you anticipate introducing optional masking at some time during the school year?
Could you ask the question again, Nick?
Yep, sorry. Do you anticipate introducing optional masking at some point during the school year?
It's a good question. I think we, like everything, have just monitor what the public health conditions are and what the safety guidelines are. So, I think as we've all experienced with COVID-19 over the past however many months at this point, 18 months. It is something that we need to adapt to. So could there be a point in time in the school year where we aren't requiring masks? Absolutely. But I think, we're always going to fall on the side of safety. And so we'll be sure that whenever we make that choice, it's based on recommendations from, local and national health officials.
Thank you, Zach. Next question, will parents be allowed into school either the day prior or on the first day of school to see how the rooms are set up?
Yeah, so last year we had a lot more restrictive visitor guidelines. And this year, I think, as Dr. Goldberg shared, like we've thought through what we've learned about COVID-19, and so therefore have adjusted some of our practices. So this will depend school to school on kind of what the schedule is, but we will allow parents to come in as visitors, but we'll obviously do so with utmost safety. So a couple of the safety measures when we have guests in the school. So there'll be a visitors log like we always do, but with a little more detail so we can conduct contact tracing if that becomes necessary. While some of those events previously may have been a back to school event, you might have had it all in a classroom or all inside. We're encouraging many of those events, either a portion or all of those events to occur outside of the building, just because we know being outside is kind of a better place to be. If a school, as we've talked this through with a few schools who do have in-school events, those events will probably be maybe not having all adults or students in there at one time and being in a staggered way so that we can reduce the number of people inside at any given time, or ensuring people are distanced. And they'd probably be a little more structured. So you may have been used to an open house where people are kind of walking around freely, and they might, when we hold these, depending on how the school is set it up, it might be more structured where you're actually kind of working through classrooms in a set schedule beyond, rather than just kind of going from classroom to classroom at your choosing.
All right, thank you, Zach. The two following questions are slightly related from two different individuals. How many children will be in each classroom? So are we changing the number of students that can be in a classroom? And will parents be informed if another student in that class tests positive?
So in the go ahead.
No, go ahead, Barbara. You can probably speak to the elementary side.
Okay, so elementary typically has 26 students in a class. And yes, you will receive notice if a student in that classroom tests positive. Absolutely.
Okay, thank you, Barbara. Next question, are you required to tell us if our child's teacher tests positive for COVID?
So the note would be that somebody, a staff person has tested positive, but we won't name specifically which adult or student has tested positive. That's a confidential matter. So, but we will say a student or a staff member has tested positive.
Barbara, just a clarification, you'll also note if that individual, that student was considered a close contact and needs to quarantine, correct? And
Oh,
get-
absolutely. Yes. Thank you.
Yeah. Okay. And last year, I believe that was sent out from the principals via Kinvo. Is that what people can expect this year?
Yes, yes. Some will send it home. It depends on the school and at what time of day we find out and how quickly we can get it out. But typically, if it's later in the day, we'll send it Kimvo just to make sure that it goes out.
All right, thank you. I have a high school related question. Will everyone around a student or the entire classroom be in quarantine once there is a case who tested positive and isolated? How does this work with a high school student who changes subjects?
We do contact tracing. So we actually speak with if it's a high school student or middle school student, we speak with them directly, who they've been with, in their pod, outside their pod, who their friends are that they hang around with. It takes a while, it's quite involved, but we do that. And the whole class won't be quarantined. We go by the guidelines of the K through 12.
Yeah, and to walk that, just to add on to what Barbara said, obviously a little bit different this year is with, obviously we had some of this at the tail end of last year, but students who are vaccinated will not need to quarantine. And there
Correct,
are,
yes.
particularly if people were wearing masks or had 3 feet of distance. So it would really be, to Barbara's point, you're kind of, it is a very involved process where we want to make sure we are being very diligent to understand who the student was nearby throughout the day for extended periods of time. So that is something that we, whenever there was a case last year, it was, the school nurses did a fantastic job of doing the tracking that. And that's why our seating charts are incredibly important, because it helps us understand on a consistent basis who is nearby one another.
All right, thank you, Zach and Barbara. Next question. When will you have data by school of the percentage of teachers, staff, and students who are vaccinated? If so, will you make that information available to families?
We do. So we have, well, I said we have some statewide data on teacher vaccination. We don't have like in our own record, the sense of individual students or staff members who are vaccinated. So we want to work in concert with RIDE and the state education agency, as well as public health officials to determine, what level of detail they have and can be shared.
Thank you, Zach. Next question. Are teachers going to wear a mask all the time?
Yes. Except when they're eating.
Thank you. Thank you, Barbara. Next question. What about children with severe asthma? How will they be protected?
So the children with severe asthma, of course, they'll be wearing a mask. And you certainly, parents, if it's severe, and they could wear a face shield as well. But really just ensuring that the spacing is done correctly, and that they're taking their preventative medicine at home. And if there's a positive or probable, we will let them know right away so that they can have them see their physician and be quarantined.
All right, thank you very much, Barbara. This next question, I'll actually point this at Dr. Goldberg. There's a question about Delta variant and whether or not there is a more serious variant that we're now seeing that's developing beyond Delta.
Just to get back to Delta, because I'm seeing some erroneous information in the Q&A. We do not at this time believe or have the data to support that Delta is more deadly than other variants. We know that Delta spreads faster, that the R0 is almost double what it was for Alpha, which means that if with the Alpha variant, one person would infect 3 people, with Delta, one person could infect 6 people. So we do know it's more infectious, but we actually do not at this point have data to support that it leads to more hospitalizations or more deaths. There are reports of other variants that could be coming to the United States, but currently what we're seeing in Rhode Island is predominantly Delta. And I think it's important to say that over the summer, we've looked at what the CDC has come out with, what the American Academy of Pediatrics and what Rhode Island Department of Health have come out with, and we are constantly revising this data. We're going to use our testing data and the information we collect from the beginning of the school year to make decisions about the safety and health protocols. So this is an ongoing process as we learn more about the science, and a lot has been revealed to us over the last 18 months. We started last school year not even knowing that the virus was airborne. And as soon as we knew it was airborne, we brought air purifiers into the classrooms and equipped ourselves to be prepared for this. And there is funding to get PPE and get protections and put those in place. And from my view as a physician and someone that works in the emergency department and does research on COVID, I feel that Rhode Island schools, public schools, have done a good job of putting those protections in place for our families. Another thing I just want to note, because I'm seeing a lot of comments, is about the virtual learning option. One of the reasons that the CDC is now coming out with very specific guidelines for schools is that we know that in-person learning is higher quality than what we're seeing with virtual learning in terms of growth. And maybe Kichara Bradford can talk a little bit more about this, but one of the reasons why there's been such a big push to get people back to in-person is because we're not seeing the learning gains that we would see with in-person as we are with virtual. And we still believe, and the data supports, that the school environment is much safer than most other social environments. And that's why we showed that 5% number in the beginning of our presentation, that the majority of COVID cases were coming from outside and not from inside of our school setting. So maybe I'll give some time for Kichara to answer.
Yes, thank you, Dr. Goldberg. I'll just chime in and say, in addition to just higher quality connection with students and the learning process, how the brain works. We know that sight, smell, sounds all make a difference and an impact, and student engagement. We have seen cameras off. We've seen, decreases in attendance. We want students back engaged and feeling like school is the place for them to be during the day. We also support many working families. I know, raise your hand on the call if you're a working family, and parents need to go back to their place of employment. And we have a great place for students to come, learn, be healthy, and thrive. There were also comments just about mental health and wellness. And I think across the nation, as well as within our community, we did see lots of spikes in just mental health concerns and students feeling sometimes depressed or more feelings of anxiety or loneliness. So really wanting to, again, provide not just the safety measures for students to return, but also the social, emotional, and mental health and wellness. We spent a good amount of time planning for the return, including adding counselors to the elementary level, increasing additional supports at the secondary level with some of our culture and community specialists. So really wanting to address engagement, social, emotional health, and wellness, as well as our attendance, and really keeping students connected to their peers, as well as the content.
All right, thank you, Kichara. Next question, what about immunocompromised individuals? What added protections do they have?
So I can add, we do have an opportunity for students who, as you've heard before, that, for students that are severely medically fragile, there is an opportunity for them to apply with our nursing as in years past, so students who may have a traumatic brain injury or are dealing with, untreatable forms of cancer. I'll let the doctors, address all the middle, that there is an option for home instruction. And that is following our, prior to COVID kind of policy just around, intense medical needs.
All right, thank you, Kichara. Next question, why is there a one-size-fits-all approach to in-person versus online learning?
So I think we addressed already, Nick, why we believe in-person learning is so important and why the American Academy of Pediatrics recommends in-person learning and why we're starting off the year with in-person learning.
All right, so we have about 5 more minutes left. We want to make sure we answer as many of these questions as possible before we conclude the town hall. All right, let's see here. All right, so a question about teachers eating in the classroom with students. Will they be eating or sharing the same space?
Typically, teachers are not eating in the same space as students. It'll depend on when a teacher's lunch break is, but it is typically, there might be an adult, there will be an adult supervising students, whether they're eating in the cafeteria or in the classroom, but it's typically the adult is not eating during that time. So they would, during their lunch period, the teacher's lunch break would be eating outside in another space, but it wasn't typically with students.
All right, thank you, Zach. So I have,
Sorry, Nick.
okay, so that's okay. So just another question around distance learning and whether that will be an option this year.
Only for students that are compromised, medically fragile, and they have a doctor's note. And if a child is quarantined, they'll be doing distance learning or isolated while they're home during that period.
All right, thank you very much. For a student to inquire about potential distance learning at their school, if they're immunocompromised, who do they contact?
That would be the health office. And our number is 456-9318. And you can call us and we can give you all the information or ask any questions that you need.
Next question, what type of substitute teachers will be filling in? Will they be tested for COVID?
We are fortunate that we were able to retain a number of our substitute teachers who were with us last year. We have increased the rate of pay, knowing how important it was to retain and have consistency in those teachers. One of the things we did last year and will continue to do this year is, rather than have typically or historically we've had substitutes kind of call in and be assigned to a different school depending on the day. And we tried to do, we did this last year and we'll continue to do this year, where a substitute would be assigned to a building, and so that they wouldn't be moving from school to school. Now that might mean they're in one class one day, and then if there was another absence, they might move to another class. But part of the onboarding, as we onboard them, we talk through the health and safety guidelines, so that if they are in another classroom, obviously they would be masked and following all the health and safety protocols that we have adults follow in the building.
Zach. Let's see, do students need to be vaccinated to join a sport?
No, there's not a requirement for vaccination for sports.
We're pretty much at about time. Just want to take these remaining few minutes for any closing statements from our panelists to our families. Family members, if your question did not get answered this evening, or if you think of any additional questions, please feel free to contact us by visiting the Providence Schools website. You can click onto the Contact Us button and leave us a communication on the Let's Chat tool. Any closing remarks?
I'll add a few things, and then I don't know if the superintendent, Dr. Goldberg, or others would want to chime in. Obviously, this is we take the start of school preparations very seriously, and this year is unlike any other. We had a lot of preparation for last year, and feel like we were able to successfully open all of our schools safely throughout the school year. Not that everything went perfect, but I think we were able to do it consistently, and we're able to learn, and that gives us a lot of confidence as we come into this coming school year. Though we know if one thing proves true is that we always need to be flexible and watching the health conditions, and as we've learned more, we know that we need to be responsive to change that may come up. So I say that to say is we take this very seriously and have been planning for the start of school for the past several months, and we hope that you all have taken some information away from this, but we have full confidence that we'll be ready to go and open safely for our students and staff in the coming weeks.
I just wanted to take a moment also to thank all the families that are here. This shows how engaged you are and how interested you are in this topic and how much you care about the safety of your children and our staff. And that's really wonderful to see. Like Mr. Scott said, we care very much about the safety of the kids. And if you look back at the Rhode Island Department of Health K through 12 data, you'll see that there aren't big differences between the cases that we saw in the virtual learning communities versus in the in-person communities. And we'll continue to monitor that data that's available to us. And I just want to thank again everyone for attending.
I'll agree and say thank you all. We are definitely taking in your feedback. We will continue closely monitoring the situations and communicating if there are any changes or updates. Thank you.
Superintendent, any parting words?
I just want to say thank you to the families for being so considerate and understanding in the work that we're doing. I also want to say thank you to the team for presenting today, knowing that the work that we do, it's not easy, but we're going to continue to do the work, to do it the best way we can to make sure that everyone is safe. And if they have any questions, please feel free to always call us, ask us anything that you feel that you need to know. We're here for you. We're working for our families and our students. So please don't hesitate. We're here. We're going to do the best work we can to make sure that all our children and all our families and teachers are all safe. Thank you.
Thank you, Superintendent, and thank you, Barbara, for walking us through this presentation. Being mindful of time, I just want to leave this up on the screen for a moment so that you all can get our email address and the phone number for FACE. Thank you all for attending this evening. And as I mentioned, please feel free to continue to direct questions to the district. All right, have a good night, everyone.
Thank you.
Thank you. Have a good night, everyone.
Night.